So I'm Sabina, and Bhavini asked me today just to come and talk about sort of myself and my role here at Moorfields. So thank you for inviting me. So I'll sort of talk about a little bit myself, about my background and how I got to this position here at Moorfields. So my background is nursing, so I trained as a nurse when I came out of school, worked in a sort of surgical unit in a hospital for about 15 years. Took a career break while my children were in the primary school years because I was working every weekend. My husband was looking after the children at the weekend. He wasn't having much family time, so we decided to have a bit of a career break and see. And in that time, I sort of noticed changes to my sight, and which I didn't really sort of tell anyone about, like you do, thinking I'm a mum at home, I can manage, I'll be fine, A little bit of denial perhaps as well. Anyway, eventually I did go and see a GP who then referred me to Eye Clinic. Ophthalmologist was seen by a consultant and said that I had a genetic macular condition, which was obviously came as a bit of a shock. Didn't really know what it was or anything like that, and really on the time of diagnosis was just not really given any support. I was told that I might be able to get a free iPad. I don't know what that meant, but anyway. Went home, sort of in denial again for a bit, for a couple of years actually. Just plodded along, and then I was fortunate, had a very good supportive family. My husband was very supportive. Just thought give me space to deal with it on my own in my own time. And then I contacted the Macular Society, and they were really lovely. Said, oh yes, we've got a conference coming up soon, maybe you should go and attend. So I did, complete out my comfort zone, go on my own to this conference, and in that conference met lots of people who had a similar condition to me, and I thought, well, you know what, I'm not the only one. I learnt, and I learnt talking to people that they were working and they were all in education and they were living fulfilling lives, and it was a real sort of awakening for me at that point. I then joined the Macular Society Working Age Macular Group and met other people, socially, and those people now are still very close friends of mine. And that, I think, really gave me the confidence to sort of believe in myself perhaps again and sort of adjust to being sight impaired. And I was registered as sight impaired for like 3-4 years after diagnosis. And then I became a volunteer for the Macular Society. So I volunteered for them as well as RNIB and other sort of charities as well. And then I thought, well, I think I'm ready to seek some sort of employment. I had skills being a nurse, and I know I couldn't go back into that particular type of nursing with my sight condition, because I was doing like some high dependency unit, lots of machines and drugs and infusions and stuff. So I knew I couldn't go back to that, but I knew I had skills. I'd gained some confidence. I knew what my own condition was about, and met other people. So I then did sort of venture, I think it was the Action for the Blind Employment Service. Had a lovely person at the end of the phone there, so we spoke for an hour once a week. So one was about just hunting and vacancy searching, and then applications and interview experience. Did a couple of mock interviews, which was really crucial, exactly what I needed. And then I was fortunate enough to get the job as Health Hub Support Officer at the time for the Friends of Moorfields. I then very shortly after that did the ECLO course as Eye Clinic Liaison Officer. So I worked in the Health Information Hub, which is based at City Road, which is provides a drop-in service for patients. So that was a new thing that the Friends of Moorfields had taken on, and they were keen for someone like myself to be there full time. So that was kind of like a project that I started from the beginning, really. There was nobody who had done that job before in that post, so it was quite exciting, daunting but exciting. I'll just tell you a little bit about Friends, actually. So I work in the hospital, but I'm actually employed by the Friends of Moorfields, with a charity. We work for the trust, and our main objectives is to sort of help patients, their patient experience, and staff as well within the hospital. So we would allocate grants, buy machinery, bits of things that the hospital may need that come to us, put an application in, and we'll process that. So as well as the Health Information Hub where I work, one of the main things that the Friends also does is have a volunteer service. So we have over 200 volunteers, active volunteers, across all sites, so including City Road and all the sites across London and stuff. And these volunteers primarily are there to support patients in various different ways. So the Health Information Hub, so as I said, it's a drop-in service. So I'm there Monday to Friday, 9 to 5. People can come and visit me after their appointment. Sometimes I get referred by doctors, nurses, ophthalmologists, optometrists as well, saying, well, there's someone there. It kind of provides a quite informal environment for patients to come to get some information. So maybe somebody who's just been newly diagnosed, someone might be newly diagnosed and just want to know more about their sight condition. It may not be because they'll be having sight loss, it may just be they're just thinking, oh, I've got glaucoma. For some people that could be quite life-changing. And I can talk to them about, Glaucoma UK, where they can there's obviously support services within there about eye drops. I can give them information about different compliance aids if they're struggling to put the eye drops in. Also, if they're going to have any treatment, further treatments, whether it's transplant, corneal transplants, or any sort of laser treatment. Moorfields also has lots of leaflets information for patients, so I can sort of give that to them as well. And also, patients are experiencing sight loss. They can, as the early intervention is key. Something that I didn't get at the time that I had to really sort of find for myself, and it took over 3-4 years. And really, if someone had just said to me, there was an ECLO, there's some sort of support service, there is a Macular Society, I might have sort of tapped into that sooner. And also with assistive technology, so I've got a small selection of technology at the hub, so I can demonstrate various apps to patients as well. I've got a tablet, so I can show them accessibility features. We're also looking to digitalise the hub at some point. We are in conversation at the moment with the estates team to how we can have various assistive technology actually displayed at that information hub. Obviously it has to be safe because it's a main thoroughfare for patients, and security as well, not someone just picking up and walking away with it. So we were thinking of things like in phone shops where things are onto the wall with the chain and something like that. So we're looking to doing things like that, and there's lots of companies out there would absolutely like to have some of their devices there at the hub, and with someone who knows a little something about it, I can demonstrate that to them. We won't be there selling the equipment. It's just there for patients to make that sort of choice, that informed choice, and see what is out there. And it's surprising to people that come and say, oh, I'm struggling to look at my phone, I try not to use my phone so much, and it's just a matter of sometimes just changing contrast or increasing the font, small things like that, I think, at the time, and can really be helpful. And also I can, obviously, a lot of my work is signposting to various other charities as well, like Retina UK, and I will say there's a support group, there's a London support group, these are the details. I can signpost them to various other, if they're in education, there's charities like Blind in Business, focus on graduates, and placing them into various professional roles. So I think because the hub is quite informal, I've got 2 chairs, it's semi sort of private, people can just sit there and I can talk to patients, and I've got time as well to sort of speak to them as well. And the Health Information Hub has really sort of developed, so I've been there for 4 years now, really sort of is the hub of, like, if there's any awareness events or there's any even trust-wide initiatives, it's quite nice. They come down and sort of want to sort of promote that at the hub as well. So lots of sort of departments within the hospital as well. Dementia Awareness Week as well. So we had a safeguarding team coming down. They'll give me the information about what they're doing, what we're doing as a trust as well. So it's a real sort of hub of information for across the board, really. So, and we're working really hard to sort of, digitalise that at the moment as well. And of course, as I said to you, I was previously a nurse, and obviously with nursing, your registration lapses if you don't practice. And I've been out of nursing for about 9 years. And a couple of years ago, one of the head of nursing here said, had I ever thought about being re-registered, becoming a registered nurse again? And I didn't think that really was possible, but I was told absolutely you could. My line manager was very keen for me to undertake the return to nursing course. The trust totally, behind me 100% with the own development team. So I, last summer, re-registered, started a return to nursing course with City University, and they were very helpful as well. So I completed the return to nursing course, and I was re-registered last summer in July. So I think that adds to my role as well as an ECLO, as also being registered nurse. That opened doors into clinics. So with friends, we were thinking it'd be quite nice for me to sort of tap into clinics, actually be present in the clinics, but that was taking me away from the information hub. So I didn't want people to come to the hub and there was nobody there. I do have a few volunteers that support me in that role. Patients themselves that may have had eye conditions themselves and want to sort of speak to patients and give information back to them. So just recently, last few months, we've been discussing how can we do this, and I've been sort of doing other different projects as well within Moorfields and with friends as well. So we recently employed Julia as a health hub support officer. So Julia will be working 3 days a week, working alongside me at the hub to really support the service that we provide there. So when I'm being taken away from the hub, or I can go into the clinics and doing other sort of projects, there'll be someone, a health hub support officer, and Julia will be doing the ECLO course.
Yeah, that'll be June.
In June, so very excited. Yeah. And Julia's a background of optometry as well, so she's lots of knowledge on low vision and other sight conditions and stuff. So we're very lucky to have her. So that's me really. It's a really exciting time at Friends as well. The volunteer service that we have was really sort of helped the hospital get back onto their feet following the pandemic in terms of one-way systems, guiding patients. We have a phone support team now as well that ring patients, especially after the initial lockdown. Patients were very reluctant to come to hospital. They weren't attending their appointments. It causes a trust that wasn't good. It didn't look good with patients were not being seen because they were scared to come in. So we've got this new project called Phone Support Service. So we have volunteers working from home who are ringing patients 2 days before their appointment saying, you've got an appointment in 2 days, are you attending? Have you any questions? Some of the patients were worried about coming in. And, the volunteers then can explain to them that we've got masks at the door, no one's allowed in until 15 minutes before your appointment. We have a one-way system, we've got social distancing, just to reassure those anxious patients, I think. And that really did help with the whole not attending appointments and just, giving them an idea of what we're doing as a trust to keep them safe, as well as our staff as well. And recently this is another reason why we employed Julia as well, because I'll be the clinical lead for this new project that we're doing called Volunteer to Career. So as we say, we've got loads of volunteers, 200 over volunteers working for us and volunteering for us. But this project, it's funded by Health Education England through their charity called Helpful. So they've given us some money. So we applied for this grant and we were successful in the application, where we were to get a small group of volunteers specifically to go through a formal pathway to become a volunteer, to get a job within the NHS, or a education program or degree level course towards a career within the NHS. So I've just started doing that. I'm presenting the business case next week, when we'll be presenting to the board as well, Moorfields in July. And we've just put out expression of interest to volunteers, and I had 44 responses. So I think we're probably going to do about 25 volunteers initial phase of our project, and then my role will be to place those volunteers with whatever skills they have, skill set they do have, and where they would like, whether it's whether they want to go into nursing or into medicine or into research. Or even a non-clinical role within Moorfields, and speaking to the workforce and HR departments. There are admin roles that need to be filled, and if we can fill those roles with volunteers who've done this sort of project with us, this pathway. So we're asking them to give 150 hours, and in those 150 hours we'll give them support about how to look for work, give them mentors within the hospital, give them opportunities to further progress their career in terms of whether there's courses that Moorfields do that they can then, like a safeguarding course we do with Safeguarding Champions, they could perhaps do that. We do basic life support, they could have access to that. So really supporting these volunteers to get a a role within the NHS. It doesn't have to be Moorfields, it could be within an NHS role, and or also to go into a further education course. So that's where we are with that project. It's quite exciting, and hopefully, if it all goes well, we'll be rolling that out next year as well. So I think it's sort of, as you say, it's difficult times, but there's lots of things that are going on at the moment, and to harness that with the whole, I think, pandemic and work and the NHS. People have thought about maybe working for the NHS is something they really want to do. And some of these volunteers are young, going through their A-levels, wanting to go into medicine, but it's also people in their 40s or 50s who just want a career change and want to, do a different type of role, and they can be exposed to various opportunities that we can offer them as well. And this volunteer to career program is going across the country. So at the moment there's one in Wales that we're also doing it, and a trust in Somerset, all different sort of medical, clinical settings as well. But so it's something that if anybody that that wants to volunteer or wants a career pathway towards the NHS, whether it's paid or into education, just let me know, and you can contact us at Friends at Moorfields. Yeah.
Oh, thank you.
That's all right.
Just
Any
a
questions?
quick, just one that just came to mind at the end. So the volunteer, there's a scheme. Do they have to be current volunteers, or can it be someone starting?
It could be someone new. So what happened, because we were just this project, we thought let's just put out a expression of interest survey to our current volunteers and see where we go, because we were thinking of doing 25 for this first phase, and we got such a good response. Great sort of volunteer with great skill sets. So we were thinking what we might do is just do the first 25 with our current volunteers, but we will be advertising externally. So if we do roll this out, we'll be open to anybody that wants to come. They don't have to be current volunteers. Yeah.
Okay.
Would you mind if you shared any contact information, how anyone could get involved?
Yeah, of course. Yeah.
In the follow-up email, if you could
Absolutely.
email me, and
Sure.
I can put that in the follow-up email for everybody, just in case they want to get involved.
Yep.
In Friends or sort of NHS jobs opportunities or volunteering. That'd be great.
Yeah, sure.
Any other questions?
I have a question. You spoke about how following the diagnosis and then initial cycles, you stopped working, or you'd taken a break from nursing with your children. And I'm just wondering about the route for you back into work from there, and what any training that you did in order to be able to access the systems at work, mobility, that kind of thing. What sort of things were you doing?
And so once I secured the job, you mean what support I had?
Or before then, that I'm just interested in that journey towards...
Yeah, so I wasn't particularly a techie person either. So my husband did sort of get me an iPad and said, here you go, I think you should use this, and just like flung it my way and said, here you go, you learn it on your own. This cruel to be kind type thing. And that's what I needed. He knew that's what I didn't want someone to say, well, this is an iPad, this is what you need to do. So I sort of looked around the iPads, and I put my accessibility features on there. I obviously did ask for help, and I, through speaking to various people in the support groups, they were using technology, they were using their phones. So I was talking to them, what were you doing? What did you do when you got somewhere? What did you do? And they're like, oh, well, I did this. And I thought, well, doesn't work for me. But then someone said something, and it was all about hints and tips. So I have to say I did learn a lot from other people by just speaking to people, and then going home and thinking that doesn't work for me, but that actually does. And then learning, it was a bit of a self-discovery, a bit of a I sort of learnt myself slowly and adapted my technology to suit me. I use a lot of magnification. I'm a bit of an Apple user, so I use everything that's Apple and phones like that. But I did do the RNIB technology for life. I did tap into that. I did watch a few YouTube channels about how to switch on and off voiceover and things like that. Even just emailing, using the iPad to use, it was a slow journey. It was quite frustrating lots of times, you can imagine, but I did sort of do it on my own. And of course, when I got to work, I was well supported. Access to work was there, and got the assistant. I use overlay software on the computer. Work provided me with an iPad as well because I've been using it, and because I'm at the hub, it's something small. It's mobile. Sometimes when I have to go to clinic, I can take it with me. If I go to meetings, I've got the iPad there, so I asked anyone if there's any PowerPoints to give them a PowerPoints before, so I can have a look at them because I won't be able to see them on the screen and things like that. Just making people aware as well what I need. In terms of mobility, for me, moving around, it's okay because I have my peripheral vision. It's quite good, and how it's funny they'd say because my central vision is affected, but just automatically your eyes sort of compensate your weakness. So my peripheral vision, my depth perception is quite good. So there's furniture in the room. I can sort of gauge if I'm close enough where the furniture is. So in terms of mobility things, I didn't need any support at work. It was more about accessing technology, being able to email and use Word or presentations and things like that. So I used an iPad majority of the time, and then obviously the overlay package on my computer in the office. Yeah.
Thank you.
All right.
Thank you. Thank you. Thank you.